Thank you. My paper would be intraocular pressure and retinal circulation alterations in pregnancy with preeclampsia, no financial interests. Now we do know that pregnancy, especially preeclampsia, stated as PET from now on, and eclampsia, impact both the intraocular pressure and ocular perfusion pressure. Now this has a relevance for patients with pre-existing glaucoma and for prognosticating the hypertensive pregnancy cases post-labor. Because of increasing age of pregnancy and the altered physiology and impending pathology, this is of relevance. And for prognosticating hypertensive pregnancy, we need constant vigilance. So very little work has been done globally on these select group of patients. So we had a cross-sectional comparative study with the Department of Ophthalmology and Obstetrics, and 80 patients were taken. Pregnant patients aged 18 to 40 years with a period of gestation of more or equal to 20 weeks, with the best correct visual acuity of more than 20/40, with a clear ocular media because OCTA had to be done. The cases were the patients diagnosed as preeclampsia, and the controls were healthy age-matched pregnant patients. Excluded were the chronic hypertension, systemic comorbidities, and conditions which would impact the vascular factors. The refractive error, high refractive error, and prior ocular surgeries and smokers were also excluded. The parameters assessed were obviously the best visual acuity, the intraocular pressure, fundus examination, central corneal thickness, and the mean ocular perfusion pressure, or the MOP, and also the mean arterial pressure. The OCTA was done by the Cirrus machine, with the minimal signal strength of 6 was taken, and the foveal avascular zone was measured, the superficial vessel density, foveal, parafoveal, and peripapillary retinal nerve fiber thickness. In addition, radial peripapillary capillary vessel density was measured. So what did we find? That for the similar pregnancy age, the MAP, obviously the mean arterial pressure was higher in the preeclampsia, that's a no-brainer, but the intraocular pressure was also higher, although that was not significant, but the corrected intraocular pressure was significantly higher in the preeclampsia, and the mean ocular perfusion pressure also was significantly more in the preeclampsia. The foveal avascular zone, all these pictures are showing the foveal and the parafoveal, superior, temporal, inferior, and nasal. The difference from the normal pregnancy was not significant. This is the radial peripapillary capillary vessel density. Now this was very significant in the preeclampsia cases. The vessel density was more. Retinal nerve fiber thickness was similar. So this is a brief video showing how the OCTA was done. And remember, these were all pregnant patients who had been brought from the obstetric department. And we had measured them with dilated examination of the fundus. So this is a virtually non-edited video of how the foveal avascular zone and the other areas were measured by the OCTA. So this is one of the cases where the superficial capillary plexus in preeclampsia was measured, and this is another one for the peripapillary nerve vessel density. And as I said, the retinal nerve fibers were similar. So what did we find? That IOP and corrected IOP was significantly more in preeclampsia vis-a-vis normal pregnancy. We know that in normal pregnancy, there's almost a 10% reduction in IOP due to increased outflow facility. So something is different in preeclampsia because of increased BP. Maybe the aqueous secretion is more or the outflow facility is less. Ocular perfusion also was significantly more in preeclampsia, which would be because of both the systolic and diastolic pressures counteracted the increased intraocular pressure. Retinal nerve fiber thickness was similar to normal pregnancy because there was no retinal edema, so probably eclampsia it would not be. But the macular vasculature was preserved, the foveal avascular zone was undisturbed. Optic nerve head perfusion, especially the radial peripapillary capillary vessel density, was significantly more, and probably only one patient had disc edema also, so probably that the optic nerve perfusion is undergoing a change. Limitations of a study, cross-sectional post-mortem follow-up was not there, and severe eclampsia was excluded. Strengths, case control, both OCTA and MOP was done, adequate sample size. It demonstrates increased IOP and more in the ocular perfusion and retinal vascular changes despite a normal clinical fundus, which means autoregulatory mechanism of retinal vasculature supersede and give a normal retinal flow at macula, but the optic nerve head is much more vulnerable. Implications are that increasing maternal age because of different problems, because of physiological stage of pregnancy does result in altered ocular hemodynamic alteration, and we need to look at this more significantly because of the female population, especially those who have pre-existing glaucoma. Thank you.
Kirti, could you show us the slide of exclusion criteria once again, please?
Yeah, here.
You have written obstetric conditions other than preeclampsia.
Like gestational diabetes and twin pregnancies, because twin pregnancies are supposed to impact the ocular perfusion more.
See, once the inclusion criteria is preeclampsia, the other things automatically get excluded. So probably this was not required.
Actually, twin pregnancy and eclampsia can go together, and so can gestational, so we had mentioned this. Therefore,
Okay. So what is the clinical implication of this study?
yeah, exactly what I said at the last, that we are facing now that increasing maternal age and preeclampsia happens in 7 to 10% of pregnancies. So we are looking at altered hemodynamics in these patients, and especially if they are diagnosed glaucoma, it would be much worse. We have not studied the diagnosed glaucoma cases, but it would be much worse, and since Octa is now available, we can have a look at the hemodynamic alterations, because that would have implications on the visual field changes and the long-term prognostication, because we are right now saying that it is altered. Would it come back to normal after labor? We need to know, and there are not many studies on this. And most of the ladies would become pregnant, and out of them 5 to 10% would have preeclampsia. So it's a huge number we are looking at, which we need to check. So that's the clinical implications.
Yeah. But the RNFL, you said there was not much of difference.
No, RNFL, ma'am, wasn't, because there was no vasogenic edema. So RNFL thickness, these are all healthy young patients. They were not glaucoma patients. So they have a normal RNFL, and if there's an edema, vasogenic edema, then we would have expected the RNFL to be thicker. And that could have complicated the issue, but that was not there in this patient.
Ma'am, the IUP difference in that slide you showed was not clinically significant. It was a corrected...
No, it wasn't. It wasn't clinically significant, but it was higher than the ones which is there in normal pregnancy.
So was there a difference in the corneal thickness? Corneal thickness
yes.
in between these two groups?
Very pertinent. If you can see the corneal thickness again, it wasn't very significant as is evident, but when you did the corrected IOP measurements after the corneal thickness, it became significant. So although there was not much corneal edema, but definitely the corneal things have changed, and the IOP after correction became significant. And this is again more important because normal pregnancy IOP reduces. And now in preeclampsia, eclampsia it would be much worse. Preeclampsia, it is increasing. So IOP is increasing, and the vascular perfusion is also being impeded. So we need to look at these more vigilantly now, and this is a huge population which we are, it's a silent population which we are not looking at.
Okay, ma'am. Thank you.
Thank you. Thank you, Dr. Kirti.
Just small comment. Is there any going to be association of anemia and pregnancy? Will this affect our study?
Ma'am, very beautiful question. But we had ruled out anemia. Exclusion में नहीं लिखा है हमने, but all these patients were healthy, who had passed the antenatal check, and everything was healthy, and the control group was also healthy, and these were, other than preeclampsia, other things were not there. But yes, very pertinent.
Thank you.
Thank you for a very nice